Hi class, my name is Jennifer Getz and I'm going to be discussing Alzheimer's disease and the DSM-5 criteria that is used to diagnose it. A little bit first about Alzheimer's disease. Currently, the only way to confirm Alzheimer's is through post-mortem exam of the brain. Through an autopsy, they are able to see plaque buildup, and that is how they're able to confirm that the person had Alzheimer's. Alzheimer's accounts for 60 to 90% of dementia cases. The greatest risk factor is increasing age. Once people are between ages of 75 and 84, there is a huge increase, and again, at 85 and older, there is another large increase. Currently, there is no known cure. There is medication therapy that is available that can be used to temporarily slow down the progression of symptoms, but unfortunately, there is no known cure yet. Alzheimer's disease, the DSM-5 criteria that is used to diagnose this disorder. First, there is an insidious onset and gradual progression that is seen with this disease. There is also impairment in one or more cognitive domains, at least 2 for a major disorder classification. There are 6 cognitive domains. The first one is complex attention. If someone has Alzheimer's, they are easily distracted or have trouble paying attention and multitasking. With executive function, they may have trouble planning, organizing, and making decisions. Learning and memory, they will have trouble remembering most recent events, so they are easily forgotten. So this makes learning very difficult and challenging because they just are not able to recall those new memories that they've learned. Language, they may have trouble calling up the word that they want to use when talking and being able to remember the appropriate names of things. So they may end up having to describe the item. Perceptual motor, being able to understand what they're seeing. An example would be a hairbrush. They may not be able to recognize that a hairbrush is used to brush your hair. Social cognition, most of us are able to sort of filter out what we're thinking before we say it. Oftentimes with someone who has Alzheimer's, that filter is not there. So they just sort of speak whatever they're feeling and thinking at the moment. Alzheimer's disease is classified as major or minor based on different criteria. And also in both of those categories, there is probable Alzheimer's and possible Alzheimer's. With probable Alzheimer's disease, the criteria is if either of these 2 items are present. For A, evidence of a genetic mutation in family history or genetic testing of the client is turned back positive that there is a genetic mutation there for Alzheimer's. Or B, all of the 3 of the following must be present. Number 1, there's clear evidence of a decline in memory and learning, and at least one other cognitive domain, there is a decline in the 6 items that I had previously listed. Number 2, steadily progressive, gradual decline in cognition without an extended plateau, meaning that they keep continuously declining. There may be a short period of time where they seem better, but it does not last very long. Number 3, absence of other diseases that could cause cognitive decline. Note, if neither of those 2 items can be confirmed, then it is listed as a possible Alzheimer's diagnosis. Alzheimer's disease for mild neurocognitive disorder. Again, we see probable and possible listed. Probable is if there has been evidence of a genetic mutation from family history, or genetic testing of the client has also revealed a mutation. Possible is listed if there is no evidence of a genetic mutation from family history or genetic testing proving that the client has a mutation that is responsible for the Alzheimer's disease. And all three of the following are present again for possible Alzheimer's. Number one, clear evidence of a decline in memory and learning. Number two, steadily progressive, gradual decline in cognition without extended plateaus. And number three, no evidence of another disease or condition as a possible cause or contributing to cognitive decline.